Well, antiplatelets we have many types of antiplatelets, and here we have 4 groups. Group 1 اللي هي الانتيبليتلتس اللي هي cyclooxygenase inhibitors. Cyclooxygenase inhibitor will very common, very famous drug here is aspirin. The second type of drug is B2 Y12 receptor blockers. Okay, and here we have irreversible drugs and we have reversible drugs. Of irreversible drugs, what we have? We have ticlopidine, we have clopidogrel اللي هو معروف clopidogrel اللي هو البليفكس and prasugrel. بالنسبة للريفرسبل عندنا تيكا جريلول دراج وعندنا كانجريلول تيكا جريلول وكانجريلول هذوما reversible B2Y12 receptor blockers ومعروفة ال B2Y12 receptor شدير هذه اللي يختم عليها ال ADP لما يصير له ريليز من case of vessel injury it binds to this receptor and activates the platelets تبدأ بعملية aggregation. But the receptor which has a direct function related to platelet aggregation is a receptor glycoprotein 2B3A. And here we have drugs which acts on this receptor to prevent or to inhibit process of platelet aggregation. And these drugs are also divided into monoclonal antibody and synthetic molecule. Monoclonal antibody here we have abscesimab, okay, and synthetic molecule have iptipeptide and tyrofepan, 2 drugs. The last group is phosphodiesterase inhibitors, and it's well known diberidamol drug. These are antiplatelet drug which is well known and we use usually to antagonize the function of a platelet. Let's go to discuss first oral antiplatelets and then we go for intravenous antiplatelet. In oral antiplatelet, we have 4 drugs here. We have aspirin, clopidogrel, prasugrel, and ticagrelor. Okay. The first drug, if we go to mode of action, the first drug, aspirin, acts on a cyclooxygenase inhibitor, while the other 3 drugs is ADP antagonist. Okay, ADP antagonist, clopidogrel and prasugrel, ticagrelor, all are ADP antagonists. Reversibility, okay, all are irreversible. Aspirin, clopidogrel, prasugrel, all of them are irreversible drug, while ticagrelor is reversible. And here we have loading dose and maintenance dose and prodrug. What do you mean by prodrug? The aspirin, sorry, here we have aspirin, it's not prodrug. It directly acts on cyclooxygenase enzyme, while the other drugs like clopidogrel, prasugrel, and ticagrelor, it's metabolized to active metabolites, and so it's a prodrug. These are prodrugs. A duration of discontinuation before operation, if you are going to stop these drugs aspirin should stop before 5 days. But nowadays, if there's low risk of bleeding, you can continue it, or you can stop it only 24 hours before surgery. It's more than enough. Okay? Clopidogrel, we have to stop it 5 days before surgery if we want to stop it, and prasugrel 7 days, and ticagrelor 5 days. Now we come to IV antiplatelets. Here we have 3 drugs. We have tirofiban, eptifibatide, and cangrelor. 3 drugs. Specificity for this receptor B2Y12, the only one which is specific for this receptor is cangrelor. Cangrelor, I'll talk about it a little more. Why? Because it has offset of action only 1 hour. Yani if you stop its intravenous infusion of cangrelor within 1 hour, okay, the action of this drug will finish. Okay, with very short plasma half-life, which is 3 to 5 minutes. And this is its dose, 0.75 microgram per kilogram per minute. Why I talk a little about this drug? Because if you want to have bridging, to do bridging for any oral drug, for example, Levix, and you cannot stop it, I will see cases like this later on, and you decide to give something as bridging before surgery, bridging for antiplatelet. Cangrelor can be used as a bridging drug, and that's why it's important to know a little about it. Now, dual antiplatelet therapy scoring. Why we have this score? Now, I will say that if your patient is 75 years or older, you give him -2 points. If age 56 to 75, you give him -1. If age less than 65, 0, and so on. Current cigarette smoker, if yes, then give him 1 point. If diabetes mellitus, give him 1 point. And MI at presentation, when he has MI, give him 1 point. Pure BSI on poor MI or poor MI, 1 point. So according to answer, you give the points. Okay? Why? If you get a score of more than 2, simply if you have total score here more than 2, then don't stop antiplatelets. Continue, give antiplatelet. Don't stop it. Okay? If the score is less than 2, so you can stop antiplatelet. Simply, if its total score is more than 2, then continuous platelet, antiplatelet. If less than 2, it's not advisable, okay, to continue it. You have to stop it. Okay. Simply, if it's more than 2, continue with antiplatelets. If less than 2, you can stop it. Okay. Accordingly, score of more than 2 is associated with favorable benefit-risk ratio for prolonged dual antiplatelet therapy. That means if it's more than 2, give antiplatelet. Continue with antiplatelet. Less than 2, you can't stop it. Okay? Simply that's score system. That's what it means. هذا اللي معناه. طيب. Perioperative management.